Excellent. So I'd like to welcome all of you. First of all, happy International Women's Day, everyone. I'm very happy to be surrounded today by these panelists, so impressive women and men. Thanks for joining today. This is great. So today is the second event of our series on women and innovation. So we're focusing on women-led innovation in Africa, achieving sustainable health and gender equality on the continent. And I opened today's event with something that our moderator, Dr. Eva, said at our first event, which was empower a woman, empower a nation. Very strong quote by you, Dr. Eva, and I think it's very good to set the tone for today and welcoming you all for this session. And so today we are celebrating Africa women who are driving innovation in health and for gender equality. We are organizing the second event with our colleague, Speak Up Africa, with whom we're already collaborating on a great project called the African Young Innovators for Health Award. Here I have Yassine with me, who will take the floor just after me. And so today we will be focusing, so the first meeting we organized on the woman innovation, we were focusing on breaking barriers. So today for the second meeting, we'll be looking at sustainable health impact, bridging the gender gap, and also focusing on real stories and real solutions. So as IFPME, we are engaged in Africa through a different set of partnership and engagement. So for example, we are collaborating with stakeholders through partnership with our colleagues from the H3D hub in Cape Town in South Africa. We're also working with in Cameroon with the Yaoundé University. We have what I said earlier, the African Young Innovator for Health Award and the Women's Innovator Innovation Incubator that you will hear a bit from in the panel. We also have a partnership with Chatham House for the Chatham House African Leadership Fellowship, and we also, for example, engage in the support of the ratification of the African Medicines Agency through the Amata Association. I'm highlighting this work that we're doing as IFPMA through supporting the regulatory framework and supporting skills in Africa and partnership. But what I really want to flag to you now and today is that none of this is possible without the talent, the imagination and determination of innovators that fuels this ecosystem. And all of this starts with the stories. And this is why we are gathering here today, is to hear about the stories of the innovators and to hear about this woman in innovation. Because as I said, we know that any effort that we make to spur policy change and foster an enabling regulatory environment are insufficient without the fundamental base of engaged and supported innovators who are driving today's problem to create tomorrow's solution in our innovation ecosystem. So that's really the focus of our engagement, of our discussion, of our dialogue today. And I will stop here, and I really want to thank our colleague Speak Up Africa, who is co-organizing this event with us today, our dynamic and talented panelists who range from young women entrepreneurs, but also to senior leaders. So for joining us today to share their stories. And of course, a big thank you to our moderator, Dr. Eva. We are very grateful to have her to guide our important discussion today. So thanks to all of you. I really look forward to hearing from you all today. And I give now the floor to my colleague, Yassine from Speak Up Africa. Thank you very much.
Thank you very much, Cynthia. Good day to all and happy International Women's Day. Thank you for the opportunity to join this group of champions of gender equality through innovation and entrepreneur. We have a great panel ahead that will really be able to share those stories that Cynthia just mentioned. And here at Speak Up Africa, we're very much convinced that gender equality supports all of the essential foundations for a healthy economy and prosperous nations, and that it's really important that all of us come together and collectively work towards the success against the Sustainable Development Goals. Unfortunately, we've seen that women have been excluded from decision-making spaces and programs that affect their health and well-being for a long time. And today we know that voice, participation, and leadership are critical to the empowerment of women. And that is why at Speak Up Africa, we launched the African Leaders Campaign last year to really support the inclusion of women and girls on public platforms and in leadership roles to be able to encourage their participation in decision-making spaces for improved health. And really, this session today is part of our broader effort around our African Leaders Forum, which has been taking place since yesterday, both in person in Dakar, Ouagadougou, and Abidjan, and through online sessions such as the one we're in today. I would really also like to take this opportunity to highlight another initiative that Cynthia mentioned that we're leading on with IFPMA that is really particularly relevant to this discussion today, and that's the Women's Innovators Incubator, which is an initiative that's really aimed at addressing the gender imbalance that exists in Africa's health innovation landscape. We launched this program at the end of last year to really be able to provide financial support, business mentorship, media training, and visibility, as well as expert advice to promising young African female innovators. And I'm really proud to say that one of the awardees of this Women Innovators Incubator is here with us today. Her name is Angela Mugisha, and she is 29 years old from Uganda, and she really believed in her ideas and were able to put them into action, as you'll hear from her directly a little later on. She founded and is currently the CEO of Cairo Health, which is a social enterprise that uses simple mobile technologies to deploy telehealth-enabled container clinics in remote rural areas. And since 2017, Cairo Health has completed 120,000 clinic visits and facilitated 8,000 births via 36 container clinics and an additional 40 to 50 partner clinics. These are really great examples of female leadership, innovation, entrepreneurship, and we believe that together with the other young and female innovator entrepreneurs that we'll hear also about in this panel, that we will be able to demystify the notion that women have a limited role in business and innovation, and that we will be able to inspire future generations of African women to break the bias and embark in this field. I would also like to finish off my remarks by saluting the participation of Jean-Philbert Nsengimana, who in his various positions, not only as Minister of Youth and Information and Communication Technologies in the government of Rwanda, but also recently appointed Chief Digital Advisor at Africa's CDC, who has always really been driven by his passion to accelerate digital transformation and youth empowerment in Africa. Thank you so much, Jean-Philbert, for being with us today. Your participation really highlights the importance of technology and data in health innovation and demonstrates also the critical role that men can have as champions for gender equality in this very challenging field. I would also like to thank all of the other panelists, our moderator, Dr. Eva, and our colleagues at IFPMA for this very important discussion that we'll be having today. Thank you again, and I will now pass it over to Natra to take us through the next.
Hi, everyone. Just some housekeeping. If you haven't already noticed, the session is offered in English and French. So on the little globe at the bottom, you can have it in French. Any questions should be directed in the chat, as attendees do not have mic options. And now I'll introduce you to our moderator, Dr. Eva. She's an inspiring, one-of-a-kind, wonderful human being, unapologetically outspoken and passionate NCD champion with many roles and different hats. Dr. Njenga has dedicated her lifetime to people's health. She is a well-respected and world-renowned endocrinologist with a vast experience and knowledge of tropical medicine. She has been practicing medicine for over 30 years and has been a lecturer at the University of Nairobi at School of Medicine for 10 years. We are truly privileged to have Dr. Eva with us on the panel today. Dr. Eva, I give it to you.
Oh, thank you. Good day to everybody, all the very renowned women on this panel and our esteemed gentleman, JP Nsengimana. We really are happy to have you joining this very strong and Word of Women. And it's always nice to hear, I think, a man's perspective of what you think about the women innovators and what it is that you also do to support them, and even on your line, especially as a digital expert. So welcome, JP. And this event couldn't have happened without our supporters and organizers, the IFPMA and Speak Up Africa Women, and the Forum for the HAS Leadership Forum. And I would also want to thank all the other organizations and partners who already started celebrating and highlighting the role of women innovation and the role they play in health. So our event today wants to demystify the part played by women in health, and of course to show that without us participating in policy, we wouldn't be able to, especially policy regarding health, we wouldn't be able to achieve our SDGs by 2030. So allow me to introduce to you the very, very powerful panelists. I will start without any particular order, and I would like to introduce our ladies to start with. I'll start with I would like to honestly start with a young girl who was there last year, Desiree. Desiree, I think you should, I want us to have the spotlight on Desiree, please. Natra, if you can. I think you can, yes. I would like to introduce this young lady because she's been very, I have had her before, so it's very easy for me to introduce her. And I would like to tell you about her. And I think this is very important that you get to know what it is that she does. Desiree is an innovator. She is also an influencer in entrepreneur. And I think it's important that you know that when she started several years ago, she started as a young girl and has now risen to the level of a deputy director of communications and development for the Africa Women's Entrepreneurship Cooperative, AWEC. This is is hosted in New York. It builds capacity for female entrepreneurs to enable resilient business growth. It develops innovative, applied, and collaborative learning experiences to create SMEs across Africa. Her program has become like a boutique media communication. She is actually started the startup for a boutique media communications and business development consultancy. With that background in business startups, what she is very passionate about facilitating project initiatives and opportunities to engage in Africa development. She holds a degree in media and business applications from Birkbeck, University of London. Desiree, welcome today, and always a joy to be in the same forum with you.
Thank you, Dr. Eva.
I would like to now introduce Angela. Angela, you've just been told that she's an awardee of one of coveted awards. Angela is the co-founder and co-CEO of Carlo Health. She's just from across the border in Uganda. And she's an awardee of IFPMA and Speak Up Africa Women's Innovation. Angela started this Carlo initiative to deploy telehealth-enabled container clinics, which are staffed by a nurse and a lab technician from local communities in the villages in Uganda. And this serves a radius of 25 kilometers for especially communities that will not be able to access health in any other way. She's a professionally trained economist, statistician, and holds a postgraduate diploma in project planning and management. She is a small business advisory specialist with over 9 years experience leading and managing finance and accounting functions in banking, telecom, and non-for-profit sectors. Angela is a fervent advocate for vulnerable women and children, as well as rural communities. Welcome, Ajara. And now I'm happy to introduce our only man in this forum, JP, or Jean Philbert Nesgimana. He is a Chief Digital Officer, Africa CDC. And I would like to highlight that he's been working to unlock the full potential of technology and data management for the common good. He has also been appointed recently Chief Digital Advisor in Africa CDC. Congratulations, JP. Prior to those roles, he has served as a Minister of Youth and ICT in the government of Rwanda for 6 years. And during that tenure, he spearheaded Small Africa Alliance and Youth Connect Africa, two Pan-African organizations that focus on accelerating digital information and youth empowerment. Before joining the government, Phil led the national and Pan-African organization in the donation of digital health and e-government. He holds a Bachelor of Public Administration from the Harvard Kennedy School of Government, Global MBA Information Technology from SP Jain School of Global Management in Singapore, a Master's in Software Engineering and Bachelor's degree in Computer Science from the University of Rwanda. He serves on many boards, including the Alliance of Affordable Internet, where he is honorary chairperson, IntraHealth International and Press Fund. Welcome, JP. And now I go to Jenny Wokai. Jenny Wokai is a CEO and founder of Clarifia. Clarifia, she is a systems engineer. Jenny is a system engineer with over 8 years experience working at very high-tech companies and as a managing consultant, and also in the US government, federal government. She has a Bachelor of Science in Biomedical Science, a minor in anthropology, and also she has attained other Masters in Forensic Science at Stevens University, as well as a Master's in Systems Engineering from Georgetown University. One of the most important issues to Jenny is making good healthcare ubiquitous to all vulnerable populations, especially in Nigeria. She recognizes that good health and well-being is key to a life that is well lived. And this is what has led birth to Clarifia, which she will tell us a little bit more when she gives her personal story. This is a platform that connects patients to community health workers to provide fast and affordable healthcare in semi-urban rural parts of Africa. As an entrepreneur and mentor, her passion for social impact has spanned through several sectors, focusing on young entrepreneurs developing solutions to address society's very tough issues. In Washington, D.C., Jenny, where she lives, she has established herself as a reference person for capacity building and youth development, supporting young and minority entrepreneurs with business care, case business plans development, and pitching for competitions, preparations, and fundraising advisory. As a result, she has helped over a dozen young entrepreneurs in the national capital area to raise more than $100,000 in the past 2 years. Welcome, Jenny.
Thank you.
And now I introduce my country mate and Dr. Anastasia Nyarita. Dr. Anastasia Nyarita is one person I know very well who works really hard in our country. She is currently the CEO of the Kenya Health Federation. She has an undergraduate training in pharmacy at the University of Nairobi and obtained her postgrad in business management from the same university. She is also a certified in the corporate governance trainer, as well as a board evaluation and assessment trainer. She has a solid background in business leadership, commercial operations, and technical operations, having led and excelled in these roles during her tenure in many multinational pharmaceutical organizations with the responsibilities across Sub-Saharan Africa and Southeast Asia. As the CEO of Kenya Health Federation, she is currently leading the policy and advocacy agenda for the private health sector in Kenya, including public and private dialogues and public and private partnerships. So welcome, Dr. Nyarita.
Thank you, Dr. It's a pleasure.
Karibu sana. And now may I introduce Madi Sharma. Welcome, Madi. Madi is the entrepreneur and founder of Mad Group and West UK advocacy lead G100, and she'll tell us a little bit more about that. She is actually the founder of an award-winning entrepreneur behind the Mad Group. It's a private sector, so companies and some of the most non-profit organizations with a philosophy to create the trader companies, to create innovative ideas tailored to local action, which can achieve global impacts beneficial to society. She's an expert in female entrepreneurship and women economic empowerment, and you will learn more as she tells us about her story. Mad has received the honors of Asian Woman of Achievement and UK's Best Boss. You will tell us how you become the best boss later, as well as the Woman of the Decade. Wow. Well, congratulations, Mad. Many, many hats that you wear. You are an entrepreneur and a leader. All Ladies League Award, she got that during her tenure. And in May 2018, Mad was listed as one of the most apolitical 100 most influential people in gender policy. How about that for one of us? Congratulations, Madi.
Thank you.
So that is our panels. This is I couldn't even tell you everything about them, but I am waiting, and please be ready to listen to their stories, because that's what has brought us here, to be able to celebrate all women innovators and entrepreneurs, not just in Africa, but globally, and to show that we can make a big difference. With our resilience, we will be able, and persistence, we will be able to make sure we sit at that table, at the policy-making decision table, so that we can influence policies on health, and to make sure that by 2030, we'll be part of that team that achieves the SDGs. So I would like to start our panel with, because we are all women and one man, let's please give the first opportunity to JP. So JP, please, can you start in the next 7 minutes? Tell us about what it is that you do, why you've chose what you have done, and what you have achieved so far. Thank you. Welcome, JP.
Thank you, Eva. First of all, you have no idea how I feel so privileged to be the only man among such a distinguished lineup of beautiful and innovative and powerful women leaders who are leading innovation across our continent. It's really a great pleasure to be here. This is a memorable day for me. Always, it comes one day before my birthday. So it's only associated with good memories. So I want to really thank Speak Up Africa, Yassine, for bringing me closer to you and inviting me to participate. And when I was listening to you, Eva, talking through the bios of all the speakers, I was, feeling like, okay, I'm not here to teach or to share anything. I'm really basically here to learn from all of you guys. So a bit on my journey, I think how I got where I am today, I think I cannot talk through everything, but I think the most relevant experience is the one I had as Minister of Youth and Information Technology in the government of Rwanda. I got the privilege to serve in such a unique position, bringing together young people and technology, and experiment what is really possible when somebody tries to really realize the combined power of leadership, partnerships, technology, and entrepreneurship, and then see how this can impact lives of the nation, in the economy of the nation, but most importantly, the lives of people, young people themselves, and especially young women. So in that position, one of the things I got the privilege to start and the drive is something called Youth Connect. Youth Connect is an initiative that tries to leverage the 3 Ps that I just talked about, policies, partnerships, and leadership and programs. So first of all, Youth Connect, you can Google it, is the youthconnect.rw for the part in Rwanda. It's an organization that started in 2013, but now grown to 25 countries with very, very ambitious goals to create opportunities for 25 million young people across the continent and achieve full gender equality in all its programming. So policies are very important. That's where the leadership plays a role. And the leadership is at different levels. We're talking about leadership at national level, leadership that sets, laws, regulation. In Rwanda, we are very fortunate to have a president who's a true he for she champion for women empowerment. You may know that Rwanda has achieved more than 65% of women in our parliament. I think is the most gender equal or gender balanced parliament in the world. And the laws have been reviewed to remove any historical imbalance or gender bias in terms of rights to education, access to opportunity, but also things like access to land and property. So leadership plays, national leadership plays such a big role in setting the tone. In government, there is a minimum requirement of 30% to women in the cabinet, but today it's actually 50% when you look at the composition of the cabinet of the government of Rwanda. So I really had that privilege of growing up in such environment that empowers women. For me, it comes as natural. And I want to just say that empowering women is not a privilege that men owe or give to women. It's just a matter of common sense, economic common sense, legal common sense, and moral common sense. And I think whenever we scan across the environment and we see that there are still inequalities and imbalances, I think those things need to be addressed with a sense of urgency. So, but also leadership, we need to scan, from government, and then we go to the private sector. And this is where a lot, especially in my domain, the domain of technology, is a domain where a lot still needs to be done. We see that women representation at very high level of leadership in technology companies is still low at the board, at the CX level. And this, I would say, it's not by design, but I think it's just a consequence of so many years that women did not have equal access to education, and especially science and technology, engineering, mathematics, and design education. And that trickles almost up. So if the foundation, at the bottom of the pyramid, you don't have equal access to opportunity for education and empowerment, then at the top, a few years later, you will see that there will be that imbalance. So the way we address this is to make sure that we not only achieve equality, but equity, which means at some point you need to bring more women to play and to participate to make up for the gaps that we've inherited from history. So for me, equality is not enough. Equity is what is good, because equity will go an extra mile to address the imbalances and the legacy of the past. And then let's go to innovation leadership. This is very important. I think there is no question that the future of Africa will be forged by its young people, most of whom are digital natives, increasingly a big percentage, not yet majority of young women participating in innovation and technology. all these new jobs of the future we're talking about, whether data science and so on. I think that a lot has to be done to identify and nurture and support women technology and innovation leadership. Again, I would say that being in Rwanda, I've been very, very fortunate to be part of empowering such women. It takes intentional efforts and intentional programming. I think it's really not enough to talk about policies and leadership and stay there at a sort of high level. We need to go down and say, let's scan and see in all our programs and see how many women are participating. And it's not just enough to put out an announcement and say, hey, there is this award competition and expect that men and women will participate equally. I think we need to go the extra mile of inviting, encouraging young women to come and participate, and even put some program just for them. So in Rwanda, for example, one of the things we started when I was there and still growing is something called Miss Geek, which is an annual innovation competition, identifying young girls who are doing good stuff, good innovative solutions in the space of technology, IoT, and artificial intelligence, robotics, these sort of quote unquote fourth industrial revolution technologies, and really bring them up, recognize them, encourage them, and put some fuel, in the form of money into their innovation so that they may become role models for others. So I want to say that when we talk about leadership, let's not always talk about national leadership. Let's really go down and go up to the community level, and then even family level. Leadership in the context of a household. I think the role of the woman needs to be strengthened and start addressing the cultural legacy that kept our mothers and sisters and spouses and behind historically. So that is on the policy now. I think Youth Connect addressed the program part. Let me just close on the partnership side. So partnership is important. I think when I look at what the governments are able to do, what the development partners are able to do, what the private sector is able to do, nobody alone can achieve it. So it's important to design platforms that bring all those actors together so that we may align on policies and programs, and then most importantly, put our resources together in support of women-led innovation. So the two programs, Youth Connect and Smart Africa that you talked about, Eva, were such efforts to provide a platform that can bring together all those. Again, very high level, we need to start building those platforms up to our communities, in our schools, really to make sure that our efforts are well aligned in support of our women in innovation.
Thank you so much, JP. I just admire what the Rwanda has done. You are leading from the front, and I like what you said. It's not a matter of equality. It is we have to go that extra mile and achieve equity. And the way your government has actually initiated this it's actually the only maybe government in our region where you have 50% of women representation in your parliament, but going out extra mile to 5%. Look for women. Yes, looking for women and girls to actually bring them in any program that comes up. I think that's something we should all emulate, and hopefully all the policymakers and governments and organizations and programs go out to look for girls as young innovators. 65% of women representation in parliament and 50% in cabinet is admirable. And I think, JP, you have actually covered almost all the questions that I had for you today, but there's only one question I would like to ask you before I go on to the next person. What are the one or two things you would change if you are given a chance to make it easier for future entrepreneurs and innovators, especially the youth and also the women? What is just one or two things that you would change?
First thing is to address the connectivity gaps. You know, there is one of the things I do is I'm the chairperson of the Alliance for Affordable Internet, and a very, very good recent research called The Cost of Exclusion showed that excluding women from participating in a digital economy has cost countries $1 trillion. So the research done across 32 countries, most of them African countries. And the fact that women have been left behind in being online and participating in the digital economy is cost not just individuals, but really having a huge economic impact. So I would really go the extra mile and remove the barriers that prevent women from being connected and participating in the digital economy. That's number one.
Okay. Yeah. Thank you so much, JP. Please stay on. This is really exciting, and I'm sure you're going to get quite a number of questions from the attendees. So please don't go anywhere. We want you to stay for a little bit longer, and as you listen also to our other panelists. Okay, thank you so much. That was really, really engaging and very stimulating. I would like now to request Madi Sharma. Please. Welcome, you are our next panelist. Please tell us about your story, and for the next 7 minutes, focus on your story. What has inspired you to choose this line? What helped you, and what were the hurdles you faced, and what is G100 and its aim? Answer those questions in 7 minutes, and I'll be excited. Thank you.
Okay, that's brilliant, Ava. Thank you very much. And I just want to thank JP, first of all, for speaking, because we won't get the change unless we have men around the table. It can't just be women on these platforms. And he also made some really, really valuable points. And as you picked up, the equality, equity, and parity that we need to make the change. So thank you very much, JP. It was inspirational. Dr. Ava, my NGO has a similar saying to yours, in that we say that the strength of a nation lies in its women. But you cannot have the strength of a nation, and you cannot have that economic empowerment and sustainability that we need for development unless those women are healthy. And each woman and girl needs to be healthy, because each one of those women and girls will go on to help more people. So health is a key criteria. So my journey to health has been a strange one, but let me point out that I am what you call the elephant in the room. So of all the panelists you introduced, I am the only one who has no qualifications. And therefore, I am the one who represents the billions of women around the world who don't have qualifications, who are actually excluded from being in society actively. My name is Madi. Madi stands for Make a Difference Ideas. Everything that we do comes from ideas, not just my ideas, but the ideas of other people. And why ideas? If I give you $1 and you give me $1, we each have $1. But if I give you one idea and you give me one idea, we each have 2 ideas. And it's these ideas that will make the global changes that we're looking for. We can solve poverty, we can solve hunger, we can make sure that people have access to food. But it's not the politicians who are going to come up with these ideas, it's the people. And that innovation is driven, exactly as JP said, from the grassroots, from the communities, from the families, because like, I think it's Angela, you see the problems at the grassroots and you want to make the change. So the question is, how can we make and help those people, women especially, make that change? And that's where incubators, mentorship, everything is so important. And so that's part of what I'm doing. But I also have to explain that on my journey, and this is the most important thing for me that I like to share with the audience, is that if I can do it, you can do it. I am without qualifications, without skills, without any training. I was in poverty when I started my first business. I'm a single parent with 2 kids. I'm Asian, I'm female. Everything was against me. And then on top of that, I am a survivor of domestic violence. So I'm representing 1 in 3 women, 1 in 5 men who are going through this. So I didn't have the confidence. My CV was empty. Nobody will employ me. So I had no choice but to become what we call a necessity entrepreneur. And that's how I started my first business, in my kitchen at home, making food. That's where I became Asian Woman of Achievement and the UK's best boss. And I'm going to put my hand up and tell you that I also failed and lost everything after 8 years. But I didn't stop, and that's the important thing. And I don't want women to think that failure is a negative. It isn't. It's a learning curve. And therefore, I want everybody to have a go. Please, if you have an idea, let's turn your ideas into action, because they will make change. So this is what we do. We help people drive that change. Today, I'm running multiple companies. I'm speaking to you from Delhi today. Last week, I was in Abu Dhabi. Tomorrow, I will be in France. A few weeks' time, I will be in Africa, hopefully in Uganda, hopefully in Rwanda, because I'm now also supporting the health business through another health initiative, which is coming directly to help governments support the health of their nations. So you can see that everything I do is driven by my desire to make change, actually because of what I went through. Now, if this is happening to me, how many other billions of women are there out there that can be like me? And so that's what I want to bring to the table. And that's where G100 comes in. And G100 is 100 global women who have been assigned the responsibility of a sector. My sector is communication and advocacy, but we also have health sector, we also have technology, we have public relations, digital economy, and each one of us as the 100 global chairs appoints 100 country chairs, and each of those 100 country chairs within the sector appoint 100 regional and city chairs, and each one of those appoints 100 members. By the end of 2022, we will be 1 million women. If the objective of the game, the object of the whole thing that we're doing is to make gender equality a reality by 2022. By the end of 2030, if we can make gender equality a reality, SDG number 5, we can do all the other SDGs, because, as JP said, you have women in the roles that make the change. And so I will finish there, Dr. Ava.
Thank you, Maddy. And you start by saying you have no qualifications. You have I can't even count the qualifications I picked. A fantastic communicator, and you give us hope, and you give the girls and women innovators hope that everything is possible. And I think what you are telling us today, and what I'm learning from you, is perseverance is the key. And if you keep pushing and moving forward, you can make the difference, and you are the difference. So this your stories and the stories of our panelists is what keeps us going. You are very inspiring. I want to ask you just one question to loud up your presentation. What do you think is the issue that women do not enter in the kind of work that, especially in the kind of work that you are engaged in? And what would be the message for these young girls as they begin their journey? Since you are our peer, you are success story, you've done so much and you have not stopped doing much. And you said failure is actually what should inspire you to move up. So what would you, as you mentor these girls and young entrepreneurs, what is the one message you want to send them? Just one message.
So you must be the change you want to see.
Yes.
Gandhi said this.
Mm-hmm.
You must be the change you want to see. No excuses, says Maddie.
Mm-hmm.
We make up excuses. We listen to other people who are frightened in case we succeed. So they are the ones who are trying to stop us because we will succeed and they didn't. And it's because you start. You have to start. Whatever it is you want to do, you must start slowly, simply, small steps, but please start. And
Great.
from there, we will overcome the barriers, the challenges. You can contact me at any time. I will help you.
Wow. Thank you. Thank you, Maddie. And that's one message. Make that first step. And the rest is going to be encouragement from all of us, from Maddie and my other partners who are on this panel, and a good number of women models and a few male models like JP, who actually has shown us that it's him. There's nothing like gender inequality or equity. It needs to be cultivated. And I think making that effort, we can move forward. Thank you, Maddie, so much. I'm seeing messages already. Your story is very inspiring. So keep at it. Please do not tire. Do not tire at all. So our third panelist is Dr. Anastasia Nyarita. Dr. Anastasia, please could you tell us a little bit about your story? Focus on your story for 7 minutes. And exactly what it is that inspired you to choose the line you are in, how you overcame the naysayers, and the challenges that you have come across to ensure, and what it is that you did to ensure that we have a strong base for innovators. And how do you see yourself empowering the youth of today? Dr. Nyarita, welcome.
Thank you, Dr. Eva, and good day to everyone. So what I'm currently doing, as Dr. Eva said earlier, is leading the advocacy and policy agenda at Kenya Healthcare Federation. And Kenya Healthcare Federation is the private health sector board of KEPSA. So in Kenya, the private sector is very well organized. So we have the apex body, which is the Kenya Private Sector Alliance, and it has 18 sector boards, and the sector boards basically mirror the government ministry. So you can imagine, when you have a private sector that is organized to, collaborate and work with the ministry or dialogue with the ministry, with the government, that makes it a lot easier for the value addition of the private sector. So under KEPSA, we have the health sector board. So we do matters health. We take care of matters health. We have a board. We have a secretary which I lead, and then we have technical working committees. Now, on a regular basis, and this will happen also next week, every quarter we have scheduled meetings with the Ministry of Health, the CS chairs, plus our chair of the federation. And I'm saying this just to let you know that at the end of the day, it's a value addition, and value addition for me is what I saw as an opportunity in Kenya Healthcare Federation. And how is this? So my career has been in the private sector, in pharmaceuticals especially. I've had the opportunity to engage at the IFPMA Council when I was chair of the R&D Pharma Association in Kenya, which is also a member of Kenya Healthcare Federation. Now, the opportunity I saw was, you have this sleeping giant that actually transformed health in Kenya and private sector health in Kenya, and also the collaborations between us and the government and other partners, including development partners. Now, before then, as the chair of the R&D Farm Association of Kenya, which is CAPI, which is an affiliate of IFPMA, I was sitting on the board of KHF, and I was at that stage of my career where I really needed to serve and see what impact I can create. So the opportunity came, and I jumped over to be the CEO of Kenya Healthcare Federation. And for me, the motivation was, bring the corporate culture into this institution because of the potential that it has. Of course, there were many naysayers, and along the way, I have faced many naysayers. And they come in all sorts and forms. Are you sure? Will you make it? Your career will crash. But I mean, until you serve, and that is the stage I'm in, you don't know what you can create. So it's been one of those journeys. For me, growing up was like, and I thank my parents, because you can be whatever you want to be. It's up to you. You choose this school, it's up to you. We are not going to facilitate anything. And the other thing that has actually helped me is also, these networks, by joining associations, whether it's a Pharmaceutical Society of Kenya, of course, IFPMA was very active, especially getting the board of CAPI to serve in the different committees of IFPMA. And also, even when I was in the local manufacturing and the Procter & Gamble, I served in the local manufacturing. So for me, the story is get engaged, serve, participate, but also leverage those networks, because they will grow you. And also in that midst, you'll actually find those, you will study the people who have what you want, who have been there, done that, and see what path they have walked and emulate them, But also, don't be afraid to take up challenges, because there's no magic bullet. That's what I always say, The challenge with ladies is that in the environment that we grew up, you grow up in, and unfortunately this happens after maybe high school, because before then we are more or less, there's a lot of equity. I mean, Dr. Njenga, in your medical school, you are top of the top. By the time you go to medical school, you know the journey. But what happens when you get to after high school? What happens when you get married? It's a societal norms that we conform to. And we have to be conscious enough to be able to really, as an individual, not as a group. And that's the other thing I advocate. You don't do stuff as a group. You have to be your own person and really define what it is that you want. And, what is it that you admire, and start working towards that. For me, that's been the journey. And I can tell you currently, and I can see some of my mentees are online. It's also, bringing other, not only women, but also men, the young pharmacists, the young healthcare. So at the Kenya Healthcare Federation, I have interns. They finish their internship, they have nowhere to go, come and join. And really, I let them be, and they're really doing a beautiful job. On the other side, I'm also, independent consultant. So I have a consultancy firm. It's been run by a very young pharmacist. Luckily, she has gotten another opportunity, and I've told her, time to go, bring on another one. So for me, it's about empowering others, serving, but also getting engaged is very, 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 very important. And also, just not for myself, but what do I want for the institution? What's the potential of the institution, and how can I get there? And that's where collaborations and partnerships come in. Partnerships with the government, partnership with medical council, like the one Eva leads. Really, you learn a lot, but also you get known for the value proposition, and that's the only way you grow. Thank you.
Thank you, Dr. Nyarita. That's very comprehensive, and honestly, I think it's important. I can see one of your mentees saying, always grateful to you. So when you get that kind of feedback, you feel you can't give up, you get more energized. Can I just ask you something, Daktari? Is there anything, what would you say was the worst comment or feedback you got from one of the naysayers that made you actually even more strengthened and more resilient? Any one particular negative
there are many
comments? Yes,
give me one,
the worst. Give me your worst.
So I got an opportunity, and again, this is where when you define what you want to be and do, after you really soul search, then it has to align with your values and your discipline and all that. So I got an opportunity to get an international assignment in Southeast Asia, Myanmar of all places. And of course I said yes, because I knew, it's a social impact, but more important is that once you experience that cross-cultural international And I have a family, and my kids that time, the last 2 kids were below 10 years. So you can imagine what the mother told me. What about your kids? So, I mean, I tend to be very blunt, and many people like me or don't like me for that. I told them, but what would happen if I died? So lives moves, and luckily I have a very understanding husband. Is also a medical consultant. And again, it's about conversation. So the fact that you're in a certain environment, you're married or not married, or it doesn't mean that you can't be the person. It's just about conversation and really not getting that dream die. So we have to keep moving. For me, it's about moving. So even at KHF, what next? What can it become? What can it become? Thank you.
Oh, perfect. Thank you so much, Dr. Nyarita. And honestly, I think I'm just hoping we'll get more questions and have a chance to answer to our attendees, and of course, more discussions to follow. That was excellent. And I really think this is something that what you've achieved and bringing together private and public participation, and also the various boards you serve, I think your wealth of experience is amazing, and we can draw from that. Asante sana. That means thank you for those, and I'm sure there's somebody translating in French. Thank you so much. So we move on to our third panelist, and this is our third panelist is Jenny. Jenny, welcome. Jenny will be able to tell us a little bit about herself and what it is that she does, and how she has reached this far, and what helped you, what were the hurdles, and why did you choose the IFPMA Incubator? So please, Jenny, go on.
Hi, everyone. My name is Jenny Wokoye, and I am the CEO and founder of CLAFIA. So I'll start by talking a little bit more about myself, which will lead into what inspired me to start CLAFIA and get into this space. So I used to live in Nigeria as a young child. So I was born in the United States, and then in the year 2000, my parents and I moved to Nigeria, and it was the first time I lived there for 5 years, and it was the first time I experienced firsthand seeking healthcare and the difficulties that we faced, either not being able to access the right doctor or spending long wait times in a medical facility or hospitals being understaffed. So it was an experience that really stayed with me, and I knew that I wanted to solve or basically be someone who can be one of the change agents in this space. I knew firsthand that I didn't really want to be a doctor, because in a country like Nigeria, or in many countries across Africa, there are so many things that you need to solve for before you get to the hospital setting. And I knew that there was just so much that needed to be done outside the medical setting or medical facility, hospital setting. So it was just an experience that really stayed with me, and which inspired the birth of CLAFIA, which is a digital health primary care service that connects individuals and businesses to health practitioners to provide on-demand primary care services. And just about my background, right? So I'm a systems engineer by trade. I've been a systems engineer for 8 years. I've spent time either working at Amazon, Deloitte, and I spent a lot of time in the US federal government. And during my time as a systems engineer, I really felt like, I wanted to be in an academic setting where I can really flesh out CLAFIA's concept. So I went back to school at Georgetown and started working on CLAFIA's concept in school. And as I got to a really good point, that's when I started to do customer discovery and get into the market and build the product. And as I've been in the space or been in the market with CLAFIA, I've realized that it has been a really good journey for me, but there are so many things that need to be solved for when it comes to healthcare access in Nigeria, across the African continent. The reason for primary healthcare, or why we are focusing on primary healthcare, is because primary healthcare is the foundation of health in many African countries, and yet it's not easily accessible because it's either expensive, a low health worker capacity, or it's just not easily accessible. And so when people are able to get access to primary healthcare, you find that their lives, they live longer lives, and they over time spend less money than they would as opposed to not having access to primary healthcare. And that is what CLAFIA is choosing to or why CLAFIA is choosing to focus on primary healthcare delivery. Also, just wanted to mention that our approach is a systems thinking approach. So taking into account all the systems at play that contribute to, successful primary healthcare delivery across African continents. If we take into consideration internet connectivity, and, most people are accessing the internet through their mobile phones, and yet and in a country like Nigeria, it's not easily accessible. A lot of people don't even have smartphones, or it's expensive, right? So we had to take those kinds of things, those systems at play that contribute to access to primary healthcare delivery in Nigeria and across Africa. So that's where that is basically, that's basically what CLAFIA is, why CLAFIA is seeking to achieve, and incorporating the systems thinking approach to ensure that Africans can get access to the primary health care that they deserve. So what helped me along my journey to get to this point was really having people around me that cheered me on. So it took some time for me to even get to have the confidence of saying that, I'm a founder in this space. I'm a woman tech founder in this space, right? There aren't that many of us in this space. There aren't that many of us in healthcare, and really surrounding myself with people who are champions for me. So those who were there to brainstorm ideas, those who were there to provide like emotional support, because this journey is really, really hard. And so those people who are able to like lift my spirits are really helpful. Those people who are also able to connect me to resources that I wouldn't readily have because it's just not available or as available to me as a Black woman or Black tech founder in this space. Women get a lot of support in the form of mentorship, but we rarely get a lot of funding. And, I'm happy for forums like this because it really emphasizes the importance of women being, in the health tech space, or just women being founders and leaders in this space, and the support that we need. And so I'm really excited to be in amongst a group of people who are really amplifying our voices. And also I would say another thing that really helped me is asking for help. Being in the tech space or being a founder, you quickly realize that a lot of the things that you need to be successful involve relationship building and building partnerships, and you cannot do anything in a silo or by yourself. And so being open to asking for help has really, really helped me, because then that has, exposed me to things or opportunities that I didn't realize I needed or didn't even realize existed. And finally, I would say just telling your story, right? You'd be surprised at the people who are willing to support you as you continue to share your story, be it on your social media channels or through mentoring people or just having a conversation, right? You'd be surprised at like most of the people who have supported me are from strangers or people that I've never met in my life. But they provided really valuable support to me to help me get through this journey. So those are the things I just wanted to highlight my journey as an entrepreneur and the hurdles I was able to face. Also just wanted to say the hurdles I was able to get through. I also just wanted to mention that, entrepreneurship is really, really hard. And, we are doing really, really great work in this space, and just wanted to encourage women who are looking to get into this space, either to be a founder. So I mentioned like not being afraid to ask for help, starting small. So sometimes we believe that in order to start a business, you have to start big. but it really helps by starting small. And because you start to realize that it takes baby steps to get to where you need to go. And by the time you look back, you've achieved so much just by taking those little steps and starting small. Also, finally, just having a long-term perspective. And this is just for people who are looking specifically to get into health, is that our impact is realized long-term. Other sectors, you might see them, like, for example, fintech seems to be getting a lot of traction these days, but with health tech, our impact is being realized long-term because, in many African countries, the infrastructure usually doesn't exist, and we are actively building that infrastructure for people to get access to care. So just have a long-term perspective. And then the last note I would leave on is, always know your why. Why did you start this in the first place? For me, it was because of what I had experienced as a child. I'm getting access to care, and it is just something that has stayed with me and has centered me when this journey gets tough for me, because access to healthcare is a basic right for everyone. And I'm really excited to be part of the change agents that is making that will make that a reality for everyone. Thank you.
Thank you, Jenny, and congratulations. You seem to have achieved so much with the high tech. And what that rings a bell for me is that during COVID, this what we've seen across all our people who practice is this now the importance of being able to reach out to your patients and to reach out to your other colleagues through mobile phones, through other platforms, e-health. And this, to me, I think as you have developed and you've worked so much in developing this and connecting patients, communities, and getting people to access care, I think this is wonderful. And this just tells, as you said, whenever it is that you feel you are challenged, ask for help. And we have panelists here like Mandy who really have done it off and continues to do it in a big way globally. This is a nice way for IFPMA and our sponsors today to connect us so that we can ask each other for help. Some of us are successful and stronger in some areas. I would get to you and find out how it is that you've been successful in tech, what are the challenges and how have you overcome them? And I think for any of the young entrepreneurs, any of the young women and even men who would like to join up and do what it is you have done, they can reach out to you. Please, I'll urge all our panelists to post their emails on the chat so that all the panelists and the attendees can see and maybe even reach out to you after this 2-hour event, so that this can be continuous and we can be able to continue to learn from each other and gain. And also, as we continue mentoring others, you realize that even in your position, wherever you have reached, you will get a mentor who has done it more and has faced even more problems and overcome them. So thank you so much, Jenny. I really have enjoyed listening to your story. These stories are the ones that make us who we are and give us that resilience and hope. Thank you so much. Now I'll go to our next the panelist, and her name is Desiree. Desiree, I would like you to first introduce yourself. I introduced you as to what you do and what you've achieved, but I want you to tell us a little bit about your story, Desiree, and what kind of challenges you've encountered and how you faced them, and what it is that made you get into this field. What would be your word to the young innovators and entrepreneurs that are coming onto the field, and whom have you mentored? How many have you mentored? What are the challenges? And what is that word that you would give people to get them hope to continue and not give up? Welcome, Desiree.
Thank you, Dr. Eva. I hope you can hear me properly.
Oh, yes, we can.
Thank you. It's been so fantastic to listen to the stories, and that's what I'm going to start with, because for anybody that's in attendance of this webinar, just listening to the stories, you realize that there is no one size that fits all. There is no one size template to life or to business. Each and every one of us is on a specific journey, and here's my piece of advice, that the best piece of advice I've been given: anyone can do what you do, but no one can be who you are. So there might be a million versions of a healthcare startup, but no one is going to run it the way you do. So if you're listening and there's something that you're thinking of doing and you feel like the market is saturated, there's no place for you, there's absolutely a place for you, because none of us will, each one of us is born unique, and we've got a very, very different set of skills that we have to offer. So that's where I'm going to start, because just listening to the stories today, I'm inspired. But my journey started off in Zimbabwe. I was born to a South African mom and Zimbabwean dad. I lived and I was raised in Zimbabwe. And then I moved to the UK about 22 years ago. And I remember the first impression of being in the UK was nobody knew enough about Africa. And I wanted to tell Africa's story in whatever shape or form I could do it. But at the time, nobody wanted to listen. If we go back 22 years, I don't think anyone cared about what was going on in Africa, not in the way that they do now. And so I did start something. I started a media company at the time, but unfortunately, I did not have organizations like IFPMA. I did not have organizations like AWEC at my disposal. And I know that's one of the reasons why I couldn't, I couldn't keep the media company going. I didn't get the knowledge, the skills, and the network that I required, like the ones that Jenny has been talking about, or Anastasia has been talking about, Maddie has been talking about. But at the same time, I have no regrets about it, because the journey that I've had has led me to where I am today. So I was then forced to start looking for work in different industries, different spaces. I took up roles that I could at the time. And then I remember most of the work that I did over the 22 years was in startups. So I worked in telco startups, media startups, fashion startups, you name it. I went through different industries, and somebody looking at my life at the time would have said I was a little bit confused, because I kept on moving from different place to place. It's only now, looking back, connecting the dots, it was for a reason. I ended up working for AWEC, which is the African Women Entrepreneurship Cooperative. So I'll take a back step and talk a little bit about why AWEC exists. Women in Africa, for those of you who are listening, may not know this, but women in Africa start businesses at a faster rate than anywhere else in the world. And that is a statistic from the IMF, from MasterCard Foundation, and the World Bank. And you can read that up. And they've been leading that charge for the past 10 years, I think. But the issue is, like everybody has been saying, there's not enough support. They can't access the knowledge, the tools, the resources, and the networks, including mentorship, that is required for them to progress in life. I'm going to take something that JP said earlier about being intentional when it comes to programming. This is what AWEC is specific about. Today, we're talking about innovation. I believe innovation is not always something, the sky's the limit. We need to reach out there to try and create some innovative stuff. I believe innovative is sometimes doing old things in a new way. So what AWEC has done, they've taken the African proverb, it takes a village to raise a child, and turns that, or flipped it on its head to say it actually takes a village to raise an empowered woman. It takes a village to raise an empowered woman who's running a business. It takes a village to raise a community, and it takes a village to raise an ecosystem. And this is what AWEC does. They came together to design an intentional program specifically focused on women entrepreneurs based in Africa. And it's a 12-month program, capacity building, that lovingly puts a magnifying glass to women's businesses in a safe place. And I say magnifying glass because you've heard from what people have said already from the panelists. Sometimes you're doing things without knowing what it is you're doing. You're clueless about access to networks that you need. You're clueless about how to ask for help or where to ask for help. And sometimes you're running a business and it's not necessarily the most sustainable model that you have. Some people are running businesses out of pocket because they have a desire to make change. But because they don't have the knowledge about how to actually run it sustainably, those businesses shut down before, before it is necessary. So AWEC came about to support women in that space. And I'm really proud to say that I'm standing as a representation of 1,000 women over the last 5 years that AWEC has been able to impact. It's 200 women every year that come together to learn. They get access to mentors, they get access to business leaders, both public and private sector. They get access to peer networks. So we have a representation of women from 52 countries and 45 different industries. The reason why this is a good thing is because they can share best practices, industry agnostic, sector agnostic, but also across different countries that, they may be able to do things in a new way. So for example, I really, really love what Rwanda is doing. I see Rwanda as a beacon for the rest of Africa in terms of their support for women. At the same time, I love what JP said around it. No, I think it was Maddie that said, gender equity and gender inclusion is not necessarily excluding men. It's actually, we need men at the table so that they can support us in that run. And so that's where I find myself. I'm a storyteller by heart. I love to tell people stories. And this is how I ended up as a media communications director for AWEC. I tell the stories of these 800 women almost every week. I get to sit and, hear, their journey, talk to them about their journey, the challenges that they face. But the programming itself literally looks at, over the 12 months, the 12 main functions of running a business. So from business strategy to processes, to supply chains, to innovation, design thinking, marketing, branding, financing, which is a huge one, because a lot of the time when the women come into the program, the first challenge they identify is access to capital, which is, it's always seemed to be the barrier. However, throughout the program, they realize that sometimes in hindsight, it's good that they didn't receive the capital because they hadn't put their processes in place. They hadn't kept their books in order. Some of the, you're on the call, don't leave me out here. Some of you are listening and you're mixing your personal finances with your business finances. You shouldn't be doing that, At the same time, you're purchasing stuff for your business and you don't write anything down. You don't keep any records about it. So, and it became even more apparent during COVID, when organizations like the World Council of Credit Unions were given a mandate to support women. In fact, they needed to give finance to more women across not just Africa, but other, developing and emerging markets. And while the money was available, it was unfortunate that a lot of the women did not have their books in order, or they hadn't been able to register their businesses. I don't know if you guys know this, but Africa Development Bank is actually now doing a program or initiative to figure out how to get more women from the informal sector into the formal sector, as well as moving their businesses from informal to formal. So registering your business and actually getting a bank account. Now, obviously, there's other variables that play into that. So for example, where policies, hinder women from getting access to a bank account, for example, because they need to have collateral or they need to be married or, certain things that need to be changed. But I'm glad that we're having this conversation because this is what is required. And so that's pretty much where I've been. One of the biggest, not mistakes, but worst pieces of advice, I'm going based on what somebody asked in the chat. Pieces of advice was, because you didn't get a computer science degree, you cannot have a tech company, right? That was one of my initial ideas, was to have an e-commerce business. But because this was like 15 years ago, I didn't really know how I was going to go about it. So I thought, speak to someone who's already done it, which is actually the right thing to do. However, I don't know whether I met the guy on a bad day, but I remember him saying, you've not done a computer science degree. You don't know anything about tech. So you're not a tech founder. There's no way you can start a tech business. So it's things like that. But, you know, I think Maddie said this, start. Because it's in the starting, it's that first step that will inform you of what your next step is going to be. If you're here and you're thinking of starting a business, start. Just start, because what it looks like now is going to be nothing like what it looks like 10 months from now, 10 years from now. So I would encourage people to just go for it. Go for it.
Yeah. Thank you, Desiree. Always a joy to listen to you. And you've brought out something very important, keeping the books, the accounting. Those are things sometimes we are not really very aware of, or we do not pay so much attention. And now, as you say, as we go looking for funds, people want to see your audited accounts. People want to know what are your successes, where are the failures. And I think it's important that you keep that. And really, that's very, very good advice to all the entrepreneurs. And you've already sent the message. I would have liked you to say to the young girls and women, and then even men who are joining this forum and who are here to support us as well. I want to ask you, how is your cooperative working? Does it fit with the government systems? Have you had any issues? Have you had any supports from the government? Or what is your take on this? Just that one question.
It's difficult when it comes to government issues, because we have to, I mean, the organization is actually based in the United States, but the focus is purely on Africa. And because we are Pan-African, each government, the struggle we have is different policies and different economic climates and different types of support for women in different countries. So, for example, it's not about naming and shaming, but it's just literally looking at the landscape of Africa. It's very difficult for us to get enough support from government in northern countries, North African countries. Whereas if you go to some Eastern countries like Kenya, Tanzania, and Rwanda, they are fueling the economy, and they want to they insist on supporting women entrepreneurs because they realize the value in supporting them. But at the same time, that doesn't stop the women in Northern Africa from wanting to build businesses. This is the trends that we are seeing. These women want to come out even more, and they want to connect with the rest of Africa. I think the history of Northern Africa versus Southern Africa and other regions has often been fragmented because of various reasons. But women want to come together and start doing what they have to build and to bring a greater investment to Africa. So when it comes to government, the challenges we have is 54 countrywide. That's the challenge we have, trying to figure out how we can get more governments to focus on efforts for women. That's the main challenge, I would say. The funding we receive as an organization is usually from either foundations, philanthropic foundations, or private donors.
Okay, thank you so much. And I think what you've said is that should not stop you. Even if you have challenges getting through governments in various areas, you still go out there and encourage the women innovators and entrepreneurs. Thank you so much, Desiree. One last thing before I let you go, 1 minute. If you have the magic word, what would you want to change in the terrain where you are in? Just wave it and say, this is what I want to change.
My biggest goal in life, this is what I believe I was born to do, is to bring a greater investment to Africa. And when I say investment, I don't just mean financially. I mean just even telling Africa's story through her entrepreneurs and reminding Africa who she is. That's the big goal. Reminding Africa who she is and bringing a greater investment to Africa. The channel by which that happens might look different for all of us, but that's my main goal.
Great. Super. Thank you so much, Desiree. And I'm sure you'll be getting comments and questions. So go to the chat box and answer the ones you can. Thank you. Thank you so much. So now we come to our last panelist, a young lady who has a lot to tell us. Angela, please, could you tell us a bit about focus on your story, how you have reached where you are, the challenges, and what it is that you'd like to tell our young innovators and women entrepreneurs. Welcome, Angela.
Thank you so much. I'm very humbled to be part of this panel and to meet all of you. For the past speakers, you're telling very inspirational stories, and I think we should do this over and over again. I'm sure the listeners can say that again. So I'm going to dive a little bit about how I ended up co-founding Caro Health, and then talk a little bit about Caro Health. So this was really a personal experience, first-hand experience when I was working on a small project in a rural area where I got sick and I could not access healthcare. Now it dawned on me that actually people have to go through this every day. People who stay in underserved communities, in rural communities or remote areas. And I was lucky to be able to access, they're just overwhelmed. They really want to help, but at some point they just, they're just overwhelmed. So as innovators, I point for the rest of my co-founding team, and we decided to begin studying the problem and understanding how best can we solve this problem. And a platform and a network of modular container clinics that are connected to a variety of doctors. Now, we equip these container clinics to certified nurses that then deliver the services to communities that are underserved. These nurses, if are not helped or empowered, they are not able, one, to hire doctors. Number two, most of them that we work with, or 99% of the nurses that we work with, have not been able to be absorbed in the public or private sectors, but yet they are certified nurses. So with us in place, we are able to empower them with the container clinic that they're able to pay off and own their own businesses within a period of 3 to 5 years. This, in a way, we continue to encourage them to help them learn simple business management skills, like bookkeeping, simple business management skills. And also we encourage them to pass on these ideas to the rest of the women. And so by many other players, we believe that we can address the huge health gap that exists between urban and rural areas. Yes, because we know that a sick person cannot be productive. Now, this brings me back to my career. I'm not a medical professional. I'm into financial management, but I realized that this is the path I want to take, to close the health gap so that people can be more productive. We have an Africa full of youths, full of energetic young people, and if they are sick, if they are not healthy, there is not going to be so much. Along the way, I did face personally challenges as a woman innovator. One of the things that I experienced personally was having that one person, to mentor you, to tell you, maybe you could do this, how to address issues. For example, when it came to business, while we were starting out, it wasn't a fast time product. We had to innovate from understanding that there is no access to electricity, and so we had to solve that with solar. And then we had to so it was a series of steps. Nurse is equipped with a clinic, she needs a doctor. So we had to again understand that how do we now do this? And to bring the whole product together into what we call now Caro Health was a series of steps, and having to go through that journey, you need someone to hold your hand. So one of the challenges that I must mention was access to someone to walk the journey with you. But how did I persevere, or how did I get here? I did not give up. That is one, because we had challenges coming along the way. For example, finance, you don't have, maybe when you're testing the product in the market, you have to explain to people, and some people receive the product, others do not. Okay. And so I had to be consistent and persistent. Number two, I had to identify a team that believes in the same things like I do. that is very important for all innovators. Identify a team and stick to it and continue innovating, solutions. And to think about this whole process, one of the reasons that I chose to, participate in the IFPMA Incubator is because, one, I would like to highlight that as an innovator, you have to make sure that even as you have your idea, you have to make sure that you identify a community that can help you nurture this idea to success, because we have businesses that fail within 1 year of inception, okay? So we have so many businesses. We have a very entrepreneurial young generation, but some of them fail. So when you have an idea and you want to breathe life into it, please do try to attach yourself or look for networks where they can nurture your business together with you, so that it can be as attaching myself to communities that are believing in improving rural healthcare, believing in making sure that someone that stays in the rural area has access to services, like this person who stays in the urban area, which we call equitable access to healthcare for everyone, everywhere. Shouldn't be a problem to access.
Ajara, we are losing
and
you.
that is why we have that goal. And then secondly, some of these spaces, for example, the IFPMA Incubator, they help all the innovations, they help your entrepreneurial abilities, they strengthen. Oh, sorry. So these connections, can you hear me now?
Yeah, you're going. But,
all right, sorry about that. So these connections help you move your organization.
I think your network is dropping, Ajara. Ajara, can you hear me? Ajara? Ajara? I think we seem to have dropped Ajara, but what she has brought out very salient points about identifying teams that you can work with, and of course, getting support, knowing where we are. So I think Ajara, she's an awardee in the IFPMA Incubator program, and she's done so well, not being in the medical field. She's, as an economist, has teamed up with healthcare workers and gotten very successful services to the people, to the very vulnerable people, in the way of these container clinics. So it looks, and it's what she's telling us, anything is possible if you set your mind to it, you are focused, and you have passion for it. So we applaud Ajara for the work she has done, and how she said this stemmed from what her experience, not seeing that she couldn't access health, and she decided to go and find a solution instead of complaining. We are human beings. We are very good at complaining when we have problems, but when you have individuals like Ajara and other panelists that will go out and look for solutions, that is something to admire. So I think I would like to really thank each one of you. This has been excellent, sharing the stories, and these stories are what really make us tick. That's what keeps us going. That's what gives women innovators hope and the drive and the energy to keep going. So I really would want to hear about any questions. Natra, if you have any questions for any of our panelists, I would really like for you to come out and give us those ones, because I haven't seen any on the panel for the questions and answers. Please, Natra, do you have any questions for us? But I would like to applaud each one of you for everything that you have brought out, and I'm sure our attendees and the participants have gained a lot from you. And I would like to thank JP having stayed on for quite some while. And I think this is very important that he was able to bring out to us as the digital specialist at the CDC, how he's mentoring young innovators, young people to come into his field and encouraging them. And I like the way he's brought out the issue of equity when it comes to gender aspect of us being involved in the policymakers. And he's coming from a country where they are leading by example, Rwanda. So thank you all. And I would like to ask any of you, before maybe, Natra, do you have any questions for us? Natra?
Dr. Eva, I think our panelists have done a good job of replying to the questions in the chat.
Oh, perfect, perfect. So then before I hand over to our sponsors, I want to go through our panelists and ask each one of you to give us one last word, a parting shot. And I'll start with Jenny. This time I'll start with Jenny. Please give us a parting shot, 1 minute each, then I'll hand over to our organizers. Jenny Okoye, will you give us a parting shot?
Yes. Hi, everyone. And just wanted to say thank you so much for this opportunity again. I'm really excited to be part of this panel and part of the amazing people on this panel who are doing great work on the African continent to support women entrepreneurs. I would say my parting thoughts as we depart and go back to our various days is to, I would say, just to believe in yourself and believe in your entrepreneurial journey. I mentioned earlier that entrepreneurship is really, really hard, but also having a lot of faith in what you're doing, right? I think, the ideas that we have came to us for a reason, and we're on this earth to fulfill a specific purpose, right? So really believe in, your why and your entrepreneurial journey, and the impact that you will eventually have if you continue to stay persistent and resilience on this journey. Entrepreneurship is, in many ways, a very rewarding field to be in. Not that many people are in that field because it's difficult, but for those who continue to stay in it, the rewards are plenty. So just encourage everyone to continue on the entrepreneur journey.
Thank you, Jenny. That's really something to take home. I would like to actually highlight somebody, Ajara, maybe, I don't know whether she will be. Ajara, are you back on the?
Yes, I am back.
Yeah, please, can you give us, I know you've said you've adopted a policy of no excuses. What is your parting shot on this forum?
Yes, thank you. So my parting shot would be to encourage women and young girls, to not give in to their fears. Just surround yourself with the right people and make sure that you breathe life. I love to use the word breathe life into your ideas and make sure that you surround yourself with the right people. This will bring Africa to the next level, and we need that really. And then to the gentlemen, I would love to also applaud Jean, who has been with us, and encourage the rest of the gentlemen out there to work with us, to support the women, so that this will be a together journey, to move the rest of the countries to the next level. Thank you.
Perfect. Thank you, Angela. Mandy, give us a parting shot.
So my parting shot is that as women, we already have the competences, we already have the abilities and the skills, and we just have to believe in ourselves that you can do whatever it is that you want to do. Just go ahead and do it.
Great.
I remember lying on the floor with my husband's foot going into my stomach and remembering that the whole of my life, people had told me that I wouldn't achieve anything because I was a woman and I had been born a girl. Look at me today, look at all the women out there, wherever they are in the world, and especially in Africa. how much they are doing for humanity.
Yeah.
And this is the power of women. And please, Africa, you are brilliant. And Desiree is completely correct. We have to have focus on Africa to make sure we drive that change for humanity. So thank you. Thank you all to all the panelists. I learned loads.
Thank you so much, Maddie. I've learned so much from you. You really are a star and you're a rock. And we can, quite a number of us will look up to you, what you've achieved after what you say is a failure. That actually gave you like a push and you just catapulted all the way up. And I don't see you coming down at all. Keep going.
I'm not.
And keep that fire burning. Thank you so much.
Thank you.
Good. I would like to get a parting shot from Desiree. Desiree.
Thank you, Auntie. I say Auntie, that is so African.
I know. And you called me that last year and I still remain your auntie. Happy to be.
Thank you. Three things. First, be comfortable with who you are. Don't be comfortable with where you're at.
Yeah. Good.
Second,
perfect.
Entrepreneurs always underestimate how much it's going to cost and how long it's going to take. Leverage your networks to learn. And third, success for us, or success to me, is to be in a world where we do not have to have the discussions on issues of gender.
Amen. Amen to that. I asked for one, I got three. Perfect. Thank you so much. And I think that's really the way to go. I like these young people. They always are full of beautiful and very, very enlightening slogans. So I think those are things that we should tweet and tag each one of us. Thank you so much. And now to Dr. Nyarita.
Yeah, thank you. And thank you for the opportunity to listen to the amazing stories from the colleagues on the panel. And thank you to the participants, of course, to IFPMA and to you, Eva. I mean, for me, one of the things that I've always believed in is that we must throw away the gender lens. So we have to start looking at things from genderless, number one. Number two, also the biases through which biases and lens that we put on and look at things, those are the things that really pull us back. So we have to throw away all the bias lenses that we have, and specifically also the gender lens. The other thing is that we need to learn, and we have to continue to learn to socialize or to exist and thrive in the natural environment, so that we are not in a corner where it's only men and women. I know there's a lot of women stuff all over the place, but again, at the end of the day, it's a natural world. So let's learn to socialize in that. And then serve, if it's your professional association, if it is in the home, if it's in the church, wherever it is, because this is what builds your grit, so that you're able to become the person that you're meant to be. So that's very important for me. And then you have to be ready to learn. I think Desiree has already said it. You have to learn, and learning is continuous. It doesn't stop at any age. And for me, really leverage your networks, she has said again, but also don't limit your networks just to your peers, across, below, age, it doesn't matter. You learn something from everybody and you impart. So for me, it's really the networks, leverage them at all levels, be ready to learn, and let's change the world. Thank you.
Thank you so much, Nyarita. Dr. Ali, you encourage many of the young mentees that have been under your mentorship. So I really think that we can do this. From JP, who left us, and although he stayed for quite a while, one thing I picked, which is so to me very important, is that if you're in a position where you can lead the mentorship to the young innovators, when it comes to women, do not wait for them to apply for whatever it is that you have put out there. Reach out to them. Look for the talented women who really would like and who would fit into the kind of programs that you are setting up, whether it is the foundations, philanthropists. Let's go out of our way and look for the girls and the women so that we encourage them. That's something I picked from Dr. JP and the kind of work they've done. And that's why maybe Rwanda is so successful in having 65 presentation of women in parliament and 50% in the cabinet. We all want that in the rest of Africa and even beyond. And it's not just Africa, even globally. So that we know that as we empower women again, we'll say we will empower a nation. So I would like to get back to our sponsors, but to thank each one of you. It's just been a joy. It's been a joy moderating your stories. And I have learned every time I continue to learn more from each one of you. And I'll personally keep in touch so that we can continue to grow together and to empower other young entrepreneurs, both young men and women. So let me hand over to our gracious supporters and sponsors for this program. I'll give back to, I think, to Greg. Greg, you're the one who's taking over. Thank you, Greg.
Yeah, thank you very much. And to be honest, I'm a little bit lost for words. I think all the words have been said, and it's been so amazingly inspiring to listen to all the stories. And if I can just say, I mean, hearing all this positiveness and wonderful concepts and ideas, especially from Europe, where at the moment, as you know, a war is taking place against Ukraine, and it feels like we're going backwards. But when I hear the words from yourselves, it looks like Africa, as we know, is moving forwards. I think this event has spotlighted an amazing set of women, if I must say, in innovation, entrepreneurship. A diversity of stories show how it is possible for women from any area to achieve amazing things. Obviously, the stories there are in cases supported by families, supported by peers, supported in the community, others through education, mentorship. The issue of good health, of course, was mentioned. But of course, what comes from it all is this burning flame and desire for making change and innovation, making things happen that is in there. I thought it was an amazing story about, and just something I learned today, that in a sense, African women are the most entrepreneurial in the whole world, starting more businesses faster than anyone.
I have brought this up.
So that is quite inspiring. I think we don't want to do this in silos. That's why it's important to build these networks for everyone to share the stories. And I hope, of course, everyone who's been involved here and those who have joined to continue the discussion here with the various panelists. I'd finally just like to mention that there was a European African Business Forum 2 weeks ago, where we made a business declaration, and within that there was an important focus on the importance of youth and women leadership and building up skills on the continent, which is a very important part, skills in this health sector, of building that ecosystem for forwarding innovation and access on the continent. I just then like to say thank you to Speak Up Africa, our colleagues, Yazin and Maela. Also, my own colleagues at IFPMA, Kamal, Natra, Paloma, Michaela, Anna Maria, Cynthia, and Mara. The panelists, Zed, Desiree, Madi, Jean-Philbert, Jenny, Anastasia, and Angela. And of course, to our wonderful moderator, who I call Dr. Eva. Others are referring to Auntie Eva, so may that continue. And if I can just summarize from what our panelists are saying, just go for it, believe in yourself, and breathe life into your ideas. Thank you so much for your time and for those who have joined. And this, of course, is one of a series of issues that we are doing at IFPMA to promote innovation, access, entrepreneurship in Africa, and women and youth leadership. It's been a pleasure to be part of this, and I wish everybody a good day. Thank you.